Let's get you updated right off the top tonight. For the very first time, a lab has detected Omicron, newest COVID-19 variant here in the United States. Doctors knew it was only going to be a matter of time, and they are expecting more cases in more places. The first confirmed U.S. patient traveled to South Africa and then came back to California. That was November 22nd. Developed symptoms, we're told, on the 25th, tested positive on the 29th. Today, a lab in San Francisco sequenced it and determined it is Omicron.
They did the right thing and got tested and reported their travel history. They had received a full dose of the Moderna vaccine, but no booster. They had mild symptoms and thankfully have now recovered.
So we know a little more about that person tonight. The CDC tells Politico that they are looking at additional potential Omicron cases in the United States. They're not saying how many as of right now. In South Africa, though, where that variant was first detected, new cases have surged in a big way in the last day. They went from 4,373 new cases Tuesday this week to nearly double that, 8,561 today. Doctors there expect cases to keep increasing rapidly since all signs point to a variant that spreads far more easily. As we know, 74% of the cases of COVID tested in South Africa in the month of November are that of the Omicron variant. There's still so much doctors and researchers just don't know about Omicron, though, and they expect it's going to take another couple of weeks, maybe 3 weeks, to know for sure if it spreads even easier than we think right now, how sick, I should say, people do get with it. While doctors work hard to learn more, our Caroline Vandergrift tonight asking a lot of questions to hospitals to see what they're doing locally, just in case.
The Omicron variant has officially hit American soil.
Yeah, I think it's inevitable that we'll see this virus spread throughout the U.S.
But it's too soon to tell exactly how it will impact the spread of COVID in North Texas.
We're not sure if it's going to be really bad or mild, whether it's going to go away or not. So we don't know yet if Omicron is going to be more contagious than Delta.
North Texas hospitals are really in wait-and-see mode right now. Most have plans on standby to ramp up capacity if they have to, as they closely monitor developments and trends, not just with COVID-19 variants, but with flu cases as well.
Take a surge of influenza and a surge of COVID. We've got a real problem with capacity around the country.
Hospitals in the area are already fairly full, with an increase in elective surgeries this time of year and nearly 800 COVID patients, according to the Dallas-Fort Worth Hospital Council.
Which is the highest we've been in a month. So we're seeing a little spike. No need to panic, but you do need to do the things we know that work. Please wear those masks. Please get vaccinated.
Doctors say unless it's proven otherwise, we should assume the COVID vaccine will be effective against Omicron.
Get a booster if you haven't had one yet. If you've not been vaccinated, reconsider that right now, because if this is a bad virus, you want all the protection that you can get.
Especially during the holidays.
And let's all do our part to keep as many people out of the hospital as possible.
Caroline Vandergrift, CBS 11 News.
We know even after recovering from COVID-19, researchers continue to learn how the virus can continue to put your health at risk over the long term. The University of Florida found COVID patients who ended up in the hospital were 2.5 times more likely to die within a year after recovering. This is compared to those who never got infected at all. The study involved nearly 14,000 people who did get COVID between January and June last year. The researchers are still trying to understand what puts someone at higher risk after they have recovered. But one theory is that the virus can harm the body in ways that can lead to more health issues later on.